My name is Taylor Girolamo, and I'm a neurosurgeon at Prisma Health. I was born in North Augusta, South Carolina, and that's where I grew up. I did undergrad here at University of South Carolina in Columbia, go Gamecocks, and I did my medical school training in Greenville, South Carolina at the medical school, which was new at the time. I went to LSU in New Orleans, Louisiana for my neurosurgery residency training and got to come back home to work here in the Midlands as part of the neurosurgery department. Neurosurgeons are specialists for the brain, the spine, and the peripheral nerves of the body. And really any disorder or condition that could impact those things are things that are within our wheelhouse. So degenerative conditions from aging, trauma, tumors, and other conditions are all things that a neurosurgeon would see in our office. And we have dedicated imaging and special procedures that help us determine whether or not those conditions would be something that would improve with a surgical treatment. In my training in New Orleans, we were very heavily focused on spine and trauma for neurosurgical care, but we also got a really great experience with tumor and cranial neurosurgery. And so my interests are pretty broad and general, and I'm happy to take care of any of those disorders in the field of neurosurgery. I actually wrote a research paper in the 7th grade about how to become a neurosurgeon and why I wanted to be one. My best friend growing up had epilepsy, and growing up alongside her, seeing her struggle with that, really gave me a passion for people with conditions of the brain and spine. And as I went through my medical school training and really getting hands-on with patients, really found that surgery and being able to tangibly do something to help people with those conditions was something that I was really passionate about. I think one of the most important jobs that I have as a neurosurgeon, especially in the hospital setting, but also in the clinic, is being able to take the information from MRI scans or information they've been told by other doctors and really take the time to sit down with patients and help them understand that information. It can be very daunting, or people can come in with a lot of fear or worry over test results they may have received. And of course, I love doing surgery and the operative side of what I do, but I think probably one of the more important things in my role is to be able to sit down with people and look them in the eye and help them understand the conditions that they're going through and be able to have that kind of human aspect of interaction with my patients as well. I love spending time with my husband and my little boy. He's 2 years old. And we have 2 dogs. We love spending time outside. I also like reading and Carolina football. If you'd like to make an appointment with me, please have your primary care doctor send a referral to my office. I would love to take care of you.